Okay, welcome back. We will continue our video series on pharmacology for health professionals. In this video, we will discuss chapter number 19, ear, nose, and throat drugs. Learning objectives for this chapter: describe the therapeutic effect of decongestant drugs, describe the role that histamine plays in allergies, compare and contrast the therapeutic effects of antihistamine drugs, mast cell stabilizer drugs, and grass pollen allergen extract drugs. Describe the therapeutic effect of corticosteroid drugs. Describe the therapeutic effect of antitussive drugs. Compare and contrast the therapeutic effects of antibiotic drugs and antiyeast drugs. When given the name of a well-known ENT generic drug, identify the trade name. When given the generic and trade names of an ENT drug, identify what drug category it belongs to and what disease it's used to treat. When given an ENT drug category, identify several generic and trade name drugs that fall in that category. And lastly, when given an ending common to several generic drugs, identify the related drug category. Okay, the first type of drug that we will discuss are decongestant drugs. Now, decongestants act as vasoconstrictors by stimulating the alpha receptors in the smooth muscle around the blood vessels. Now, when this happens, you are reducing the blood flow to edematous mucous membranes in the nose, also in the sinuses and the pharynx. So any tissue that's able to undergo edema or being able to swell, this reduces blood flow to those types of tissues. So when you get a decreased blood flow to these tissues, you get the decrease of swelling of those mucous membranes, which will alleviate the nasal stuffiness and the sinus congestion. It also will help the secretions be able to drain. It also helps to open up the eustachian tubes to the ears. Now, decongestants are commonly prescribed for colds and for allergies, and some can be administered topically as either a nose drops or a nasal spray, or can be taken orally. Some common examples of decongestants: nifazoline, which is sold under the trade name Previne; oxymetazoline, which is sold under the name Afrin 12-hour or duration; phenylephrine, also known as Afrin or Sudafed PE; pseudoephedrine, also known as Dimetapp or Trixoral or Sudafed or Triamnic; tetrahydrozoline, also known as Tizine; zydometazoline, also known as Otrivin. Alright, now we'll move on to antihistamine drugs. Now, these exert their therapeutic effect because they block H1 receptors, or histamine receptors, within the nose and in the throat. Now, histamine is a chemical that gets released from mast cells in the tissues when an antibody-antigen complex is created during an allergic reaction. So this causes vasodilation, in which the blood vessels and mucous membranes become swollen and very red. This will irritate the tissue directly, which will lead to pain and also itching. So antihistamines block the histamine from being released. So by doing so, this will help to shrink edematous mucous membranes. Also will act to decrease itching and redness. Now, there are some side effects to antihistamines. The older types of antihistamines would cause drowsiness. The newer formulations of antihistamines do not cause drowsiness because they have a different chemical structure to them. Some common examples of antihistamines: azelastine, which is sold as Astelin; brompheniramine, also known as Lodrain; cetirizine, a very popular antihistamine drug sold under the name Zyrtec; chlorpheniramine, also known as Efidac or chlortrimeton; clemastine, known as Tabast allergy; disloratadine, another very popular antihistamine drug sold as the name Clarinex; and also dexbrompheniramine. Some more examples of antihistamines: dexchlorpheniramine, diphenhydramine, also known as Benadryl; fexofenadine, also known as Allegra; levocetirizine, also known as Zizol; loratadine, also known as Claritin or Tavist; olopatadine, also known as Patinase; triprolidine, also known as Zymine. This image, we have an example of loratadine, also known as Claritin, very, very common antihistamine drug. It's one of the newer formulations of antihistamines where it does not cause drowsiness. That's why it's very common to see in the advertisements for Claritin, you will hear the phrase Claritin Clear to reinforce the fact that it will not cause drowsiness in the patient. Okay, now we'll talk a little bit more in depth on the first and second generation antihistamine drugs. The first generation antihistamine drugs, such as Benadryl, for example, are non-selective in that they bind to the central histamine receptors, the H1 receptors in the brain, but they also bind to the peripheral H1 receptors found in the body tissues. So this drug action in the brain results in the person becoming drowsy and having an impaired performance while driving or operating machinery. Now, the second generation antihistamine drugs, like Claritin or Zyrtec, for example, only bind to the peripheral H1 receptors in the body tissues. So this will block the action of the histamine and relieves the symptoms of redness and inflammation and itching that is associated with allergies, all without producing the effect of drowsiness. See, the drug hydroxyzine, also known as Vistaril, is also a first-generation antihistamine, but it is not used to treat allergies. Its side effect of drowsiness and dry mouth are actually used as therapeutic effects when this drug is given as a preoperative medication to help to calm the patient and to also decrease oral secretions prior to that patient becoming intubated right before surgery. A quick did you know? Antihistamines are not effective in treating bacteria or viruses that cause the common cold. Although the symptoms of allergies and colds are similar, there's no release of histamines when you have a common cold. Now, drug companies will often combine antihistamine drugs and decongestant drugs and over-the-counter cold remedies because antihistamine drugs have a drying effect on mucous membranes that is helpful when you are suffering a cold. And historical note about some antihistamines, the drug terfenadine, sold under the name Seldane, was introduced in 1985 as the first non-sedating antihistamine drug. Now, this was considered to be a major breakthrough, as previous generations of antihistamines would often have the undesirable effect of causing moderate to severe sleepiness. And also at this time, another non-sedating antihistamine drug was released, Hismanol. Now, however, both of these drugs were taken off of the market in 1997 after they were found to cause fatal heart arrhythmias in patients who were also taking erythromycin, which is an antibiotic drug, or if they were taking ketoconazole, which is an antifungal drug, or if the patient had liver disease. Now, later, Allegra was introduced and is still on the market. This is another example of a non-sedating second-generation antihistamine drug. Now, Allegra's chemical structure is only a slight modification of the chemical structure of Seldane. Alright, now we'll move on to mast cell stabilizer drugs. Now, these work to stabilize the cell membranes of mast cells found in the tissues of the nose. And by doing so, these will prevent these mast cells from releasing histamine during an immune response to an antigen. This will also act to prevent edema of the nasal mucous membranes and also sneezing in patients with allergic rhinitis. And a good example of this type of drug would be cromolyn, which is sold under the name Nasal-Crom. Right, now we'll talk about allergen extract drugs. This is a form of allergy immunotherapy that's previously only been available with allergy shots. This is where you have a prepared liquid extract that contains various allergens, such as animal dander or foods or plants, grasses, pollens, and so on. And these allergens are injected subcutaneously each week. These extracts that are given to the patient get progressively stronger and stronger, and to the point where the patient's body no longer reacts to the allergens. Now, there's one allergen extract drug that's specific to grass allergies that is available in the form of a sublingual tablet that's taken by mouth. Now, this drug is an extract of grass pollen from 5 different seasonal grasses. See, and the drug dose is measured as an index of reactivity, or IR. An example of this type of drug would be oral air, which is a grass pollen allergen extract. Another type of drug we'll talk about are corticosteroid drugs. Now, these act by inhibiting the body's immune system. They act by decreasing inflammation and edema of the mucous membranes. Now, these have no decongestant or antihistamine effects, and they're not used to treat the common cold. When it comes to corticosteroid drugs for the ears, these are used to decrease inflammation that is associated with allergies or common ear infections. Some examples of this kind of drug would be dexamethasone and also fluocinolone, which is sold under the name Dermotic. Some examples of corticosteroid drugs for the nose would include intranasal steroids, or INS. It could also include beclomethasone, which is sold under the name Beconase. These are also used to treat nasal polyps. Budesonide, which is sold under the name Rhinocort. Cyclizanide, which is sold under the name Omneris. Flunicillide, which is sold under the name Nasalide. Fluticasone, which is sold under the name Veramist or Flonase. Mometasone, which is sold as the name Nasonex. It's also used to treat nasal polyps. And the last one here, triamcinolone, which is sold as the trade name Nasacort. Alright, now a quick drug alert. Now, these trade name drugs all sound similar to each other, but are not related to each other. So don't confuse Nasacort, Nasal-Crom, and Nasonex. Nasacort is a corticosteroid drug. Triamcinolone. Nasal-Crom is a mast cell stabilizer drug, cromolyn. And Nasonex is a corticosteroid drug, mometasone. Alright, focus on healthcare. The nose is a very important site when it comes to your body. Air coming into the lungs is filtered, and the white blood cells from your immune system attack and kill bacteria and viruses that come in through that inhaled air. Because corticosteroid drugs suppress the immune system, they cause common side effects of nasal infections and colds. Now, TV ads for the drugs Omneris and Nasocrom mention that they cause a sore throat as a side effect, but all intranasal corticosteroid drugs have this possible side effect. So in addition, they may cause nosebleeds or yeast infections in the nose and impaired wound healing in the nose and in the throat. All right, now we'll talk about corticosteroid drugs for the mouth. An example of that would be triamcinolone, which is sold as the trade name Kenalog in Orabase. This is applied topically as a paste, and this is used to treat mouth ulcers and inflammation. All right, now we'll move into antibiotic drugs. These are prescribed for colds that are caused by bacterial infection, in particular streptococci, that cause strep throat. The common cold, this is not effectively treated with antibiotics because it is usually caused by a virus, so you need an antiviral to treat that. Although antibiotic drugs may be prescribed to prevent subsequent superimposed bacterial infections from developing, this practice is not recommended. The antibiotic drugs are applied topically as a solution to the external ear canal to treat bacterial infections. Some examples of that would be swimmer's ear, external otitis, and otitis media, which is an infection of the eardrum, the tympanic membrane. Some examples of this type of drug: ciprofloxacin, also known as Cetraxol; oxfloxacin, which is sold under the name Floxin Odic. Sulfonamide drugs, these are a type of anti-infective drug that inhibit the growth of bacteria. Now, these drugs are given orally to treat an infected tympanic membrane or otitis media in the ear. Some examples of this type of drug would be sulfadiazine and also sulfasalazine, which is sold under the trade name Gentrizin Pediatric. Now we'll talk about anti-yeast drugs. Yeast are one-celled organisms. They're closely related to fungi, and these grow very easily in environments that are warm and moist and dark, such as in the mouth, for example. And this is especially true for patients whose immune system is already compromised by another disease. Now, Candida albicans is a yeast infection of the mouth. It's also known as thrush or oral candidiasis. Now, topical anti-yeast drugs are used to treat oral candidiasis. Some examples of this class of drug would be clotrimazole, which is sold under the name Misalex, and nystatin, which is sold under the name Nilstat or Mycostatin. Another type of drug that we'll talk about in this chapter are antitussive drugs. And these work by decreasing coughing, and they do so by suppressing the cough center within the brain. And they also act by anesthetizing the stretch receptors within the respiratory tract. And the whole purpose of an antitussive drug is to control a dry, non-productive cough. There are various forms of antitussive drugs. Some are non-narcotic, some are narcotics. The first ones to talk about are the non-narcotics. An example of that would be benzonatate, which is sold under the name Tessalon. This is a prescription non-narcotic drug. Another example of a non-narcotic antitussive drug, dextromethorphan, sold under the names Robitussin or Vicks 44. These are over-the-counter drugs. These are commonly seen in combination drugs. They're used to treat coughs and colds. Narcotic antitussive drugs. Some antitussive drugs will contain codeine or hydrocodone, which are Schedule III narcotic drugs. So these prescription drugs are used to treat severe non-productive coughs. So examples of this would include either codeine or Hycodan, which is the trade name for hydrocodone. Now, antitussive drugs are not prescribed to treat productive coughs because it is important for patients who have that kind of a cough to cough up that sputum and to get it out of their body. So when a patient has a wet productive cough, it's better to give them an expectorant drug. Those are used to treat diseases of the lungs that produce excessive amounts of mucus and must be coughed up. So at that point, you don't want to prevent them from coughing. You want to encourage them to cough to get rid of the excess fluid and mucus that is building up in their lungs. All right, now we'll talk about anesthetic drugs. These are used in the mouth and in the throat to numb the mucous membranes and relieve the pain of cold sores and mouth ulcers, toothaches, braces, dentures, or a sore throat. These can come in different forms. You can get a viscous drug, a thick drug to swallow that's used to coat the areas of the mouth, or you can also get these in a lozenge form. These are allowed to dissolve within the mouth, and the drug that they contain is swallowed continuously to treat the sore throat. These are some common examples of anesthetic drugs. Over-the-counter examples: benzocaine, which is sold under the names Ambisol or Cepacol, or Chloraseptic or Oragel, and also diclonine, more commonly known as Sucrets. An example of a prescription anesthetic drug would be lidocaine, which is sold under the trade name Xylocaine. Now we talked about several different categories of drugs when it comes to ear, nose, and throat. So it's also very common to see combination drugs. For example, it's common to see a combination of antihistamines and decongestant drugs. Some common ones you'll see for antihistamines could be cetirizine, desloratadine, and fexofenadine. An example of decongestant drug would be pseudoephedrine. And here are three very popular, very well-known examples of this combination type drug. Allegra D, which is a combination of fexofenadine and pseudoephedrine. Clarinex D, which is a combination of desloratadine and pseudoephedrine. And Zyrtec D, which is a combination of cetirizine and pseudoephedrine. These are combinations of antibiotics and corticosteroids. When it comes to the antibiotic, it's common to see ciprofloxacin, neomycin, or polymyxin B used in that combination. When it comes to the corticosteroids, it's common to see dexamethasone and hydrocortisone used. This combination of antibiotic and corticosteroid drugs are used topically within the ear. These are used to treat otitis externa or otitis media, which are either infections of the external ear or of the eardrum, the tympanic membrane. Some examples of this type of combination drug: Cipro-HC-Otic, which is a combination of ciprofloxacin and hydrocortisone, and also Ciprodex, which is a combination of ciprofloxacin and dexamethasone. Colimycin S-Otic, which is a combination of hydrocortisone and neomycin, and Otosporin, which is a combination of hydrocortisone, neomycin, and polymyxin B. Some other combination drugs that you'll see: Rondec DM, which is a combination of chlorpheniramine, which is an antihistamine, phenylephrine, which is a decongestant, and dextromethorphan, which is an antitussive drug. Another example of a combination drug would be Tussionex. This is a combination of chlorpheniramine, which is an antihistamine, and also hydrocodone, which is a narcotic antitussive drug. Now move on to a drug alert. Prescription cough syrups that contain a controlled substance are very effective in treating severe coughing, but they also contain a narcotic drug that can be addicting, and they are Schedule 2, 3, or 4 drugs. Now, these scheduled drugs can cause euphoria, which is an exaggerated sense of well-being and happiness, and also lead to slowed muscle movements. Now, the DEA reports that these prescription cough syrups are available to addicts whose form of abuse is cough syrup from some online pharmacies that do not verify prescriptions sent to them. The website for Partnership for a Drug-Free America notes that the non-narcotic antitussive drug dextromethorphan is also abused by 1 out of every 10 teenagers. It can cause distortions in color, in sound, disorientation, hallucinations, out-of-body experiences, in addition to causing dizziness, nausea and vomiting, loss of motor control, and a rapid heart rate. Because this is an over-the-counter drug, it is very commonly available. Okay, that brings us to the end of this video on chapter number 19. We will continue our video series in our course on pharmacology for health professionals with our next video on chapter number 20, analgesic drugs.